Hello everyone, my name is Hyunkyung Kim of KIHASA, the Korean Institute for Health and Social Affairs. Today we have the 27th Global Social Security Forum under the title of The Role of Sickness Benefit in Times of COVID-19 Crisis. So we'll have a time to look into sickness benefit of other countries, and also we'd like to talk about the future directions concerning sickness benefit. First of all, there will be opening remarks by Tae-Soo Lee, President of KIHASA, and that will be followed by presentations. First of all, let me invite Mr. Tae-Soo Lee for his opening remarks.
네, 안녕하십니까.
Hello everyone, ladies and gentlemen. Good to see you all. And from France, Germany, and from OECD, Paris, we have invited European speakers. And I'd like to thank European scholars for being with us for today's forum. Today, we have the opportunity to talk about the role of sickness benefit in European countries, and this will be a good time for us to learn lessons about the experiences of the European countries. And Korea hasn't yet introduced a sickness benefit officially, so this is a time for us to learn a lot from other countries. Several other countries, just like Korea, are still in the process of overcoming COVID-19 crisis. Here in Korea, quarantine measures have been well in place. However, unexpectedly, the COVID-19 situation has been worsening more recently here in Korea. The COVID-19 virus is calling into question everything that has been built by humanity so far. So in humanities and also in biology, the humanity has made a lot of development and advancement. However, figuring out the COVID-19 virus itself is a big challenge for us. Despite many advancements and developments made so far by humanity, still we have this kind of big challenge to tackle. So with a lot of systems and programs, we have been proud of ourselves, but the current crisis is making us call into question things that we have done. And there have been many changes to our lives and to our culture, so in all sectors of our lives, we are being challenged, and this is a time for us to reflect on ourselves. And amid the COVID-19 crisis, sickness benefit has emerged as an important topic, especially for the Korean society these days. And this is a time for us to look into the role of sickness benefit in other countries and what kind of improvements we need to work on for the future. So these matters will be discussed together. This topic, the role of sickness benefit in times of COVID-19 crisis, is such a critical topic. And Dr. Matthias Braun, who is joining us, and Mr. Becker, Professor Becker, and Mr. Stefan from OECD, and also Dr. Hee-Jung Kang from KIHASA. So these 4 people are participating as speakers. And also Dr. Shin-Wook Kang and Dr. Ki-tae Kim from KIHASA and Dr. Keun-Ju Kim from the Korea Labor Institute are participating in the discussion session. So we'll take note of the insights shared here in this forum so that we can deliver the good knowledge to others.
그
So I
내주신 만큼
wish
좋은 성과로
the successful
그래도
result of the
연결되기를
forum,
바라는
and I'd like
마음으로
to thank you for
인사
being with
말씀
us out of your busy
가로하겠습니다.
schedules.
감사합니다.
Thank you very much.
네, 원장님께 말씀 감사합니다.
Thank you very much.
말씀으로
Thank you, Ms. Lee.
성평수당에 관해 어떤 과제를
As he
안고
already mentioned, we are going to talk about the challenges that we are faced with at the moment across the world.
멀리에서 프랑스와 독일에서
And far away
세 분의 교수님
from Korea, we have three presenters from abroad.
연말로 여러 가지 일들을
And as the time is approaching the end of the year,
자장 토론 발표를 맡아주신 많은
so we are going through a very busy schedule. But out of your busy schedule, you are graciously present here today. Thank you so much. First off, I would invite the first speaker, Matthias Brun.
들리시나요?
Can you hear us?
Yes,
Can you hear me?
Thank you very much. I'm now sharing my slides. I hope you can see them. I can see them. Thank you very much for the invitation, for the possibility to be here with you and to discuss this with you. A little note on what I do and where I come from. I am a researcher at Sciences Po, but also on my own account. And in parallel, I'm working as a physician. So what I have is a very strong health system. German, French. You cannot hear me? No? Okay, good. I'll keep talking. So the comparison with Germany is something that I usually do a lot in my research work about health systems. So I'm happy today to have the opportunity to continue doing that with Professor Becker and of course with all of you. So a very brief overview of how COVID has hit France. And it is indeed one of the European countries most severely affected, especially during the first wave in 2020. So these are figures as of October, where in comparison to the total number of the population, France shows a higher number of deaths and of confirmed cases compared to Germany. The vaccination coverage is relatively high in Europe and continues to rise. So these figures are as of October. We're now above the 70% threshold of completed vaccinations in the population. These are figures from John Hopkins. Very, very strongly. You cannot hear me? Okay, I'm not changing anything. So I don't touch any buttons. The management, particularly in the first wave, during the first wave, has been very strongly criticized. France had chosen a centralized response to the crisis, run by a relatively small team of experts close to the central executive in Paris. Critiques have been a lack of taking into account regional specificities in the situation, but also in the need to respond to the crisis. And despite the fact that all information was centralized around the government, the crisis communication in particular has been perceived as very poor. There have been very contradictory messages, especially at the beginning, concerning the need to wear masks or not. And this has led to a very strong, defiance, if not skepticism, in the population towards the ability of the government to handle this crisis. This has increased over the successive waves of the pandemic here in France. So now we are between the fourth and the fifth wave, or slowly flattening the fifth wave, and the perception of the population that there is a relatively good way to deal with the pandemic is increasing. And also the acceptance for vaccination has been increasing. We have had a very difficult situation in summer 2021, where France has introduced what they call the so-called sanitary pass. So in order to access restaurants, for instance, you have to be vaccinated, or you have to be immunized by a previous infection, or you have to be tested. This is what the Germans call 3G. This has been discussed and introduced relatively early this summer in France, led to initially high resistance, but now to a certain degree of acceptation in the population and leading to relatively soft impact of the fourth and fifth wave. In terms of the response in terms of aid to the economic sector, there has from the beginning been a very generous compensation for the affected sectors. So businesses that had to close were from the start almost been given compensation and were for a very fair share of them able to economically survive the crisis. I will, before we go to the specifics of how France dealt with the question of payments during sick leave during the crisis, the COVID crisis, briefly outline the overall functioning of how sickness benefits and sick pay in France are handled. It's basically a three-tier system, and it's different from other systems because the highest share and the highest philosophical importance is giving to sickness benefits. So this is the share of compensation of allowances which is paid by Social Security. And in France, when a person is on sick leave, this is the first mechanism. This is what first happens, that Social Security will pay you sickness benefits, and it's considered the most important pillar of the system. The second tier is then an additional compensation by the employer, which is paid at the same time. So we do not have a two-timed system as in Germany. It is at the same time completed by payment by the employer. And then the third step is that there can be additional payment residues, complements paid by provident schemes. So these are insurance companies who can be either for-profit or non-for-profit, and who can provide additional payments, but who can also act as a payment moderator for the payments that are due by the employer. So the employer can choose to pass via such a provident scheme to do the actual payments. This is the three-tiered payment system in France, which is complex, which leads to low visibility for many of the users of the system, but also for the payers in the system, because information is not always optimal between all of them. There's a lot of paperwork to be done. There's a high administrative cost, obviously, for this type of system, and there is a challenge for governance to run and smoothly run such a three-tiered system. And we will get back to some of the institutional and historical logics of that system. But that's the overview of the three-tiered system in France. What are the characteristics of this system in terms of coverage and of generosity for the beneficiaries? First, as you can see in the left graph, France has a very, very long legal duration of the compensation of the sickness benefits. They can go up to 3 years. This is because sick leave in France can be granted up until 3 years. So this is, together with Portugal, the only country in Europe with such a long potential duration of sick leave and sickness benefits. At the same time, as you can see on the right hand, the statutory, so the Social Security replacement depth replacement level is relatively low, is among the lowest in Europe with 50%. 50% are borne by Social Security, and the rest is borne then by the employer and or the private, the insurance coverage providence scheme. And what's the underlying logic in this kind of system? And here we are in the history of the French welfare system. The idea is to have a good and early protection against catastrophic expenses, and this started when social protection was introduced for workers, for minors, to allow for social peace in society. This is the primary idea. At the same time, this is the second point, the depth of the coverage is relatively low for the public system. So there's a protection against catastrophic offenses, but there needs to be complementary coverage, which is borne either by the employer or by a provident scheme. And this is the same logic as we have in the health system, where there is strong discussion and there has been increasing shift of coverage from the statutory public system towards complementary insurance. So what are now the trends and the specific policies that have been undertaken during COVID-19? And here we see a change in the logic. Overall, I have just said there has been relatively low public coverage. Overall, the response to the COVID-19 crisis in France has been characterized by a very generous provision of additional benefits for the different situations that can occur in the context of the crisis. So, for instance, I'm just giving you examples, although very frequent examples for these type of policies. There's been a new allowance for people who were not able to continue working. For instance, parents who had to take care of their sick child, of their children who were not able to go to school because the school was closed, simply. And there have been allowances for people in these situations. Also, there have been extensions for sickness benefits for certain types of population. For instance, self-employed health professionals, such as pharmacists, were not eligible for sickness benefits before. In the context of the COVID-19 crisis, if their condition, if their situation is related to COVID-19, they are now eligible for sickness benefits. Also, there has been the suspension of the waiting period, which is traditional 3 days before you receive your first payment, has been suspended for any condition or situation related to COVID-19. And as a final example, or as a final important point, the payer has been reassigned. So traditionally, sickness benefits are paid out of the health branch of the Social Security system. And as of May 1st, 2020, all payments related to COVID-19 are covered by the state and unemployment insurance directly, because it's considered, strictly speaking, partial activity. So it's not considered a disease-related condition, but it's considered a work-related situation, and so coverage is borne by the state and unemployment insurance directly, and not anymore by the health branch of the Social Security system. I will just give you one last example, which is linked to the French quarantine system and our health application in France, which can track contaminated individuals and people who have been in touch with them. And the new, I call it quote to quote sickness benefit during quarantine. And I say quote to quote sickness benefits because it's not strictly speaking a benefit for sickness, but it is a special allowance for people who are in a particularly COVID-19 related situation. So in this special case, it concerns employees who are considered contact cases. They have been in contact with a COVID-19 positive person. And if they cannot telework, and if they are at risk, that means either they regularly receive dialysis, they are cancer patients who regularly receive chemotherapy, they have other severe chronic diseases who deprive their immune system, they can request a sick leave online for a period of 7 days, starting from the contact date, and then they will be receiving sickness benefits. And this is again without the waiting period traditionally of 3 days, and it is subject to a supplement from the employer. Just some words for the overall expenditure change related to these different policies. Obviously, spending has increased, and in 2020 there has been a almost 20% increase of sickness benefit spending. And as we will see here on this slide, the progression is due to sick leave for diseases, so it is not driven by work accidents or occupational diseases, which have increased by a very relatively low percentage. And at the same time, we have an increase of payments by supplementary insurance by 12%. You can see this here in this graph. So you see the very marked increase of total expenditure as compared to the previous years, where in France we generally have a 3 to 4% increase every year. This is the standard social security spending increase. And you see in the red bar the increase driven by sick leave. So sick leave expensive, meaning they are covering regular acute or chronic diseases and not occupational diseases. They drive the progression in expenditure as compared or in contrast to occupational diseases and allowances for maternity, which have actually dropped in 2020. So to start concluding on the French case, we can see that the response of the state in France to the COVID-19 crisis, but also the overall policy for sickness benefits is driven by two logics that are characteristic for the French social policy. The first is to continuously extend social protection to certain groups of population. Historically, this concerns new professional groups or new professional or social or health-related situations. And the French state has always sought to create specific policies for specific new types of population. And historically, this has led to many different schemes of social protection. So, for instance, initially health insurance was organized by specific schemes for salaried workers, a specific scheme for agricultural workers, a specific scheme for self-employed professions, and many other specific schemes. This is the historical development, which has always, as I say, tried to create specific responses for specific social groups. The last decade has been characterized by efforts to reunify the system, to administratively also simplify the handling of payments for these people. And this is related to the second point, which is that, as all other systems in the world, France is constrained by the pressure to limit expenditure. So French social policy and the social benefits policy is characterized by this tension. And the particularity of the responses to COVID-19 so far are that this pressure to limit expenses has not been as a strong player as it has been before. This is what I said earlier when I underscored that the additional benefits and expenses have been very generous. There has been very little discussion in France about the cost. So from the beginning, the state players and public opinion were in favor of relatively high payments. And President Macron himself has coined the expression that the response to COVID has to be done at any cost, which is a mantra that has been repeated by the Treasury, by the Ministry of Finance and Economics. And there has been a certain kind of discussion about a potential paradigm shift away from the austerity paradigm and the budget control paradigm towards a more investment type of approach to spending, to government spending, which has been relatively vivid in late 2020 and early 2021, and which is now paddling back a little bit. So this is still an open discussion, and it has to be considered also under a very important perspective, which is the upcoming presidential and general election in France, which is due in May of next year. So we are in a situation where currently the government and in particular also the president are in a situation where they are looking to please as many voters as possible, and it's certainly not a good time to withdraw benefits that have been recently granted to certain population subtypes. So this is also driving and characterizing the current discussion. So it's not a normal time for policymaking in France, but all of 2021 already has been characterized by the perspective of the upcoming election, and this is in a context where President Macron has also been under pressure for other social policies, and this is mainly one of his biggest promises for his actual term, which was to reform the pension scheme in France, because as is health insurance and as are the different professional schemes that govern the payment modalities for sick pay in France. Pension schemes are related to professional groups. There are several hundreds of them in France. One electoral promise of President Macron was to unify most of it and to simplify the rules within the system. This has been fiercely discussed and initially rejected at the beginning of his presidential term. He has now, government and President Macron has now pushed through a unemployment protection reform, which is generally less favorable for most of the beneficiaries, and it is in this context particularly difficult now to change any of the rules of the policies that have been introduced under COVID-19 for sickness benefits and sick pay. So I thank you for attention. I'm very eager to discuss with you and to hear your questions and your further presentations. Thank you.
네, 마티아스 부른 교수님 발표 감사드립니다.
Professor Matthias Brun, thank you for your presentation. So there was a little bit of difficulties concerning the internet connection. However, despite the difficulty, you continued your excellent presentation. So within a short period of time, we cannot discuss or listen to every single details of the national policy. However, if there are any questions, we'll cover them in the Q&A session. So let's move on to the second presentation. Professor Gerhard Bach-Becker, can you hear us? Professor Becker,
네, 발표 부탁드립니다.
please go ahead with your presentation.
And can you see my slides? Hello?
Not yet.
Not yet.
Hello?
No, we cannot see your slide.
Yeah, I can
Yeah.
see.
Yes, we can see the slide.
You can see the slides. Okay, so I begin. Good morning in Europe, good afternoon in Korea. First of all, I would like to thank you very much for allowing me to participate at this webinar and inform you about the situation in Germany. Unfortunately, time is short, so I will start immediately. There is certainly enough time for follow-up questions. Currently, Germany is in a very serious COVID-19 situation. The fourth wave has hit the country and infection incidences are reaching all-time heights of almost 500 or 600 persons per 100,000 inhabitants. In some regions, the 7-day incidence is as high as 2,000 and more. As a result, hospitals are overloaded, and in many cases, there is a severe shortage of intensive care beds and also of staff. The hospitalization rate is high and will continue to increase in the coming weeks. Already, more than 120,000 people have died from or with corona. There are several reasons for these spikes. The vaccination coverage was only 63% of the population at the beginning of November. Vaccination breakthroughs are increasing, but without severe consequences, and vaccination boosters have been delayed. At the same time, contract restrictions were hastily dropped in the summer under the impression of the parliament election campaign, in which a so-called Freedom Day was promised from many parties. Now, since the end of November, policy reacts again, and again there are restrictions. Reintroduction of the general mask obligation, access restrictions to the public facilities, restaurants, events, trains, authorities, etc., for vaccinated, recovered, and daily tested only. No general vaccination requirement yet, but for certain professions. In particularly affected regions, reintroduction of lockdowns in wide areas of the service sector and nighttime curfews for unvaccinated persons. And at last, obligation to work from home if possible. In essence, the aim is again to reduce contact between people as far as possible in order to limit the spread of the virus. And above all, the aim is to increase the vaccination rates, both for boosters vaccination and for first-time vaccinations. Now it's foreseeable that compulsory vaccination for the entire population will be introduced in the spring of 2022. Until then, massive pressure will be exerted on the unvaccinated. No compensation payments for unvaccinated people in the event of an imposed quarantine. Access to work only for vaccinated, recovered, and with daily tests. The unvaccinated who do not submit a test will not be paid and must not allowed to go to work. Contact restrictions in private and public spaces, no access to public facilities, restaurants, retail outlets, and so on for unvaccinated persons. Looking at the development since March 2020, the restrictions imposed have led to deep economic slumps and unprecedented social consequences. The GDP fell by 3.7% in 2020 and currently shows only a very weak recovery. This is due to the prolonged lockdown measures in broad areas of the service sector, the closure of daycare care centers and schools, and the massive contract restrictions. As a result, the government revenues from taxes and contributions have collapsed. On the other hand, the government's compensatory measures have led to considerable additional spending, which can be financed solely through massive new public deficits. Coping with the COVID crisis has thus become a test for the German welfare state. On the one hand, the focus is on maintaining the best possible healthcare for COVID sufferers. And on the other hand, compensation must be ensured for the income losses that have occurred as a result of the crisis. These income losses for employees as well for the self-employed have different reasons and are answered in the social security system by different benefits. I would like to briefly name these reasons and the corresponding social benefits systems. First, the decline in sales and production or temporary closure of companies and businesses have led to unemployment and short-time work. Here, employees, but not the self-employed, are entitled to unemployment benefit and short-time allowances from the Unemployment Insurance Fund. Second, employees unable to work due to COVID-19 disease. In this case, the hospital or the home may be left only if recovery is proven. Here, employees, but not the self-employed, are entitled to continued payment of remuneration in the event of illness as an employer benefit for a maximum of 6 weeks, and a follow-up payment of sick pay by the statutory health insurance for a longer period of incapacity of work. Third, if employees have to interrupt their work due to COVID-19 illness of their child or children, they are entitled to children's sick pay by the statutory health insurance. Fourth, if employees are placed in quarantine by the municipal health department and not allowed to leave the home or go to work, this applies to employees who are infected but not ill and not incapacitated for work, and for employees who are suspected of possibly being infected or ill. In these cases, the state provides a special income compensation regulated in the so-called Infection Protection Act. Fifth, if employees have to interrupt their work due to the closure of daycare centers and schools of their children, here too, there is an entitlement to the special state compensation payment regulated in the Infection Protection Act. I would now like to go into the details of these different benefits. Short-time work in particular has been massively expanded in recent months. In April 2020, this amounted to around 6 million workers. Although the numbers have fallen sharply until the summer of 2021, they are currently rising again, partly as a result of supply bottlenecks in the global economy. Short-time working has prevented a sharp rise in unemployment. The income replacement through short-time allowances is regularly 60% of the lost net income. From the 4th month, the replacement rises to 70%, and from the 7th month to 80%. Parents with children receive an additional 7%. Continuation of salary payment is paid to all employees, including part-time work, temporary employment, and marginal employment. It is paid regardless of the type and cause of the illness and starts from the first day of incapacity for work up to a maximum of 6 weeks for the same illness. If there is another illness, the time counts again. The benefit amount is 100% of gross income, so there is no loss of income for anyone who is sick or unable to work, including COVID sufferers. If there is no more continued payment of wages, then all insured employees in the statutory health insurance are entitled to receive sickness benefits, also here regardless of the type and cause of the illness. The benefit amount is 70% of the regular gross wage, but not more than 90% of the net income. Sickness benefit in Germany is paid to a maximum of 78 weeks for the same illness. Another illness, it counts again. After expiry of the entitlement, it is possible to apply for a reduced earning capacity pension. The entitlement to child sickness benefit relates to children up to 12 years of age who are sick and in need of care as is attested by a doctor. All employees as members of the SHE are entitled for a maximum of 10 working days per child, up to a total maximum of 25 working days a calendar year, or as a single parent, 50 working days. The children's sickness benefit has the same account as the general sickness benefit. To sum up, in Germany, compensation for lost income during the period of incapacity for work due to illness is provided by a two-tiered system: continuation of salary payment and sick pay. The coverage is comprehensive and generalist and guarantees that there will be no significant income problems in the event of illness, so that employees are not forced to go to work sick and infectious, but that illnesses can be cured and secondary illnesses avoided. This is particularly true for COVID-19 diseases. Self-employed persons are excluded from these types of benefit. They cannot be unemployed in the sense of the law because they do not have an employer who continue to pay their wages. They have to take out private health insurance as they are not members of the statutory health insurance. However, for the self-employed and their businesses, there are newly introduced economic support payments, so-called bridging aids. These have been and are being provided if businesses are affected by the lockdown or suffer significant losses in sales as a result of the contract restrictions, in order to avoid insolvency or business closures. This applies to companies, solo self-employed persons, and freelancers for covering fixed operation costs from a drop in sales of 30%. The state has spent more than 140 million euros on this so far. The state income compensation benefits under the Infection Protection Act arise when employees as well as self-employed persons are sent into quarantine but are not ill or are not unable to work. The state, but not the health insurance, reimburses the wages in full for 100%. This entitlement also exists if, as a result of the closure of schools and daycare centers, employees have to care for their children at home and interrupt their work. The entitlement period is for 10 weeks 20 weeks for single parents, the benefit is 67% of the net income lost. I mentioned earlier that there have been severe restrictions on unvaccinated employees with regards to state income compensation benefits since November. Unvaccinated employees in quarantine, that means if not ill or not incapacitated for work, will no longer receive compensation for their lost earnings. Employees who are unvaccinated or do not provide proof of testing are not allowed to work and receive no salary and have to expect termination. But it is not questions that unvaccinated people suffering from COVID get continued payment of wages or sick pay. This is a fundamental principle of the German welfare state that is not asked what reasons or causes may be responsible for an illness. The search for individual misconduct is misleading because it is not possible to draw a line. With a glance at the clock, let me turn to questions. What are the empirical findings on these COVID-specific benefits? Unfortunately, there is little information on this. It is not known what proportion of COVID sufferers are recipients of continued pay and of sick pay. Overall, we can conclude that days of incapacity decreased in the last years, not increased. It has decreased in 2020 and in 2021. This is mainly because due to the contract restrictions, the usual flu-like infections hardly occurred. It is obvious that the majority of the seriously ill and hospitalized patients have already reached an older age and are no longer working. However, it is also clear that currently the hospitalization risk primarily affects to the unvaccinated. And there's also a lack of data on the size of the group of people who have received compensation under the Infection Protection Act. And it's not clear how large the group of COVID sufferers is who have left the hospital but are still suffering from the long-term effects of COVID. If I conclude with an assessment of the performance of the German social system in times of COVID-19 crisis, I come to an overall positive conclusion. The existing benefit systems, in particularly continued payment of wages and sick pay, but also short-time allowances and compensation payments of under the Infection Protection Act, have passed the stress test. The social safety net has held up, has been temporarily extended, and has prevented massive income losses, thus also stabilizing private demand and the economy at all. However, it has also become clear that the coverage of the self-employed, especially the solo self-employed, who have been so far been excluded from the social security system, is inadequate. The move toward insurance for the entire population, so-called citizens insurance, is more than overdue. Thank you very much for your attention.
감사합니다.
네, 감사합니다. 독일의
Thank you.
제도에 대해서 상황과 대상을 중심으로 해서 매우 촘촘한 발표해
Professor
주셨습니다.
Becker
감사드립니다.
made a very rigorous
발표를
presentations on the
이어가겠습니다.
role of sickness benefits in times of COVID-19 crisis in Germany. Now we are actually
시간을 드리지 못한다는 점 양해 부탁드립니다.
we have to keep the time, so you're given only 15 minutes for presentation. Now I would like to invite Mr. Stefan Tewissen from OECD. Can you hear us? Stefan Tewissen.
Here you go. Can you hear me also?
Yes.
I think I even heard myself, so I assume that's fine. Let me share my screen for you. Here you go. I think I'm on air. And can you see my screen also? Great. Okay. Well, thanks so much. I'm Stefan Theeuwissen. Indeed, I'm an economist with the OECD, working as part of the health and employment team. Thank you all very much for organizing this event. Thank you, Kihasa, in particular. I think this is very important, very timely also, given the Korean discussions on implementing paid sick leave, which I'll talk a little bit about. Let me also thank already like my fellow co-authors, actually, a few of which are on the call here also listening in, Chris and Rochelle. So thanks for joining. A very last thank you, why not, would be to my previous speakers. So compared to them, what I aim to do during my presentation is to go less deep actually, but rather go broader. And what I mean by that is, first of all, give a little bit more background information on the importance of paid sick leave as a social protection and labor market policy, even in non-pandemic times. Second of all, I also want to go more broadly in geographic terms, say. So I'm going to look across all OECD countries. First of all, to show you what their pre-COVID-19 system roughly looked like. And second of all, how countries chose to reform this and to expand this to provide better protection during COVID. And why do I do all this? Well, I mean, I have a little agenda in mind also, which is to really make a link, which I'll do in the last part of my presentation, to Korea. And indeed, Korea is actually one of only 2 OECD countries that does not have any statutory paid sick leave. So what I hope to do with this presentation is to convince a by and large Korean audience how important and how crucial paid sick leave really is as a policy. Second of all, I also hope to convince you of how important it is to get it right. Korea is like in quite a unique position now to be able to implement a new paid sick leave scheme from scratch. So it can choose actually to implement a system that is accessible, that is equitable, that is also efficient, so that promotes return to work for recovered workers, and that is also pandemic proof. So I'll be drawing on material that we've published before, which is a COVID-19 policy brief on paid sick leave. I can happily share that. I have the link also at the end of my presentation. Plus, we are actually currently working on a project on Korea, on providing examples from other countries how paid sick leave could be implemented there. Okay, so my key messages very quickly. Well, first of all, paid sick leave is a key policy to protect income, health, and jobs, not only of persons, but also of societies at large. Its role is even larger during a health pandemic. Many OECD countries have indeed temporarily expanded paid sick leave, and Korea actually introduced paid sick leave, we could say, like statutory paid sick leave for the first time in history. However, across all OECD countries, structural paid sick leave reforms are still needed. In particular in 3 areas. First of all, is to better grant access to everyone. Second of all, to better prevent sickness and to promote return to work of recovered workers, and also to make it more pandemic proof. And reforms there are particularly needed actually in Korea, given the fact that it is one of only 2 OECD countries without statutory paid sick leave. All right, let me just go straight into it and talk first a little bit about the important role of paid sick leave. So paid sick leave is quite a multifunctional policy, we could say. What its core function is to support workers during a temporary sickness spell in 3 ways. First of all, paid sick leave protects workers' incomes. This could be in the form of sick pay, continued wage payments by the employer, or sickness benefits, for instance, through social insurance. Second of all, paid sick leave also protects workers' jobs, so it keeps employment relationships intact during a period of illness. Third of all, paid sick leave protects workers' health, as it allows sick workers to recover at home rather than to continue going to work sick. We know that going to work sick actually prolongs illness, and it further reduces productivity. So the benefits of having workers go to work sick are actually very, very low. But there are actually broader advantages of paid sick leave, and over the last few years, actually more and more evidence has accumulated on this, which is that it also protects firms, it also protects societies, it protects economies at large, as it improves population health through the reduction of spread of contagious diseases. and this is called contagious presenteeism. So what happens is that a sick worker goes to work sick and with a contagious disease, and then infects others at or on their way to work. And these are essentially externalities of behavior. And those negative externalities of going to work sick and infecting others as collateral damage are very large. Estimates indicate that about 11 to 16% of influenza type infection rates could be decreased if a paid sick leave system is in place. And so those lower infection rates, once a paid sick leave system is in place, actually translates into lower absence and lower employer costs. So for instance, there have been estimations in the academic literature that the introduction of paid sick leave in a few American states led to an estimated almost 20% decrease in sick leave, mostly through lower probabilities of getting sick. And so this decrease actually also translated in lower costs for employers. So a few countries, or many OECD countries, also involve employers. So employers need to pay, for instance, for sick pay. This adds further to the role that paid sick leave can play. So first of all, if employers need to provide funding for sick pay, well, they're much better incentivized or encouraged to actually prevent labor market risks. So to prevent that they have to pay for a sick worker. Second of all, once a worker is sick, employers then have much stronger incentives to make sure that they're accommodated. For instance, that a better job is found, that their return to work is promoted. And third of all, in this way, employers are partly responsible to minimize the exit of work, so that a worker, for instance, goes into disability benefits or goes into early retirement schemes, which are very often one-way streets. So now we're going to talk a little bit about the pandemic. Well, paid sick leave is very important outside pandemic times, but during a pandemic, it very much proves its worth. So first of all, paid sick leave was the key instrument that many countries relied on to permit workers to self-isolate. And we know that providing financial compensation is actually of major importance for workers showing mild symptoms to go into quarantine. Second of all, this viral spread has been contained and mitigated. So paid sick leave allows workers who are sick to stay at home rather than infect others. And again, here there is some evidence that that viral spread decreased in places where there was paid sick leave in place. Second of all, paid sick leave allowed many who had to go in quarantine or who were temporarily sick to preserve their jobs. Last, paid sick leave is a crucial component of an effective testing, tracking, tracing, and isolating strategy, as it allows potentially infected workers to quickly self-isolate. Let me tell you a little bit about paid sick leave before the pandemic. So actually all OECD countries, except 2, Korea and the United States, and even all G20 countries, except those 2 countries, have a statutory paid sick leave system in place for employees in standard dependent employment. And in fact, Korea is even rarer because it doesn't even have employment protection legislation. So in the case of Korea, if you're sick and you can't go to work, your employer can actually fire you. This is unique across the OECD and G20 area. However, non-standard and self-employed workers have sometimes poorer or even no access across OECD countries. And we show in our policy brief very clearly actually how different countries provide different types of protection for self-employed workers. All right. So why would a country not implement paid sick leave? Well, something that is sometimes put forward is actually that paid sick leave promotes undue absenteeism. So essentially, this is misuse of the system, right? So if there's protection in place, then people will just use this type of protection, stay home and not work. Well, I mean, first of all, the evidence that this is a very big component seems to suggest that this is not as prevalent as one might think, and that actually this the other side of the coin, like sick workers going to work and infect others. So this contagious presenteeism seems to be actually a bigger risk for society. However, still, undue absenteeism is of course something to think about, and OECD countries have done so. And so, for instance, what countries generally do is to provide benefits that are a little less generous than, so that does not fully replace incomes, so that individuals still have an incentive to go to work. The duration may not be until forever, so it could be shorter. There could be also a waiting period, so that it takes a few days before individuals receive income. And actually, the better systems that we see across OECD countries have a real focus on return to work. So once a worker is sick, employees, employers, and even public authorities have an obligation to promote return to work. So to look at, okay, what work is still possible for the employee? Can the employee follow certain types of training, for instance, to find a job if the person, for instance, is sick because of back problems? Can that person retrain essentially and find a position that the person still can do? Very quickly on paid sick leave through the COVID-19 crisis. So many OECD countries and major economies have expanded paid sick leave systems during the outbreak of the pandemic, or even introduced such leave for the first time on a mandatory basis in the case of the US and Korea. However, I think first of all, it's very important to say that almost all of those measures were time-bound and limited to COVID-19 sickness or quarantine. So there's still a very big need for structural reform. So these crisis response policies are four types. First is to strengthen support to employees who suffer from COVID-19. Let me talk a little bit about that. So here I'm showing you a figure which shows you how much an employee who's sick for 4 weeks because of COVID received in June 2020. We're updating this work. I think probably the legislation is still roughly the same. And so what we can now see is that actually across the OECD on average, paid sick leave has become more generous. So before the COVID-19 pandemic, someone who had a flu essentially, or like who was sick for 4 weeks, had like a 60% replacement rate. So received during 4 weeks like a benefit that replaced 60% of her or his income. Now this went up to 70%. And we can also see in particular that like many countries expanded, in particular the US, like that now receives, like there a sick worker does not receive, like before the worker could receive nothing. Now the worker receives at least 50%. And also for Korea, like now a sick worker can receive a little bit. It's still very low, it's very little generous still compared to other OECD countries. So second crisis response policy was to extend support to quarantined employees. So this is an unprecedented policy. So this allowed employees to self-isolate. Very often paid sick leave was used for this. A third was to expand access to paid sick leave. As I already said, in particular, self-employed workers fairly often did not have access to paid sick leave across many OECD countries. And quite a few of them actually expanded access to self-employed workers, including, for instance, Germany, by the way. And so this is very, very important because paid sick leave can only be effective. It can only protect workers and societies if it is widely available. Still, however, there are very large groups that are poorly covered. Think about gig workers, for instance. Think about freelancers and other types of dependent self-employed, which are also groups that are very prevalent in Korea, for instance. A fourth crisis response is, as I said, employers often have a role to play. So they have to continue wage payments. So this is called sick pay. What many OECD countries did was to take over that responsibility temporarily, so to essentially like lower the burden on employers, but also because sick pay did not really play its role, right? Like the role of trying to get workers as soon as possible back into work, like the importance of that was not very high during the pandemic. So it made a lot of sense that states here stepped in. I realized that let me just finish this slide, sorry. all of these essentially like these reforms that have been taken are very promising. But what is very important is that structural reform is still needed. As I've emphasized during my presentation, like many of those reforms that were taking place were very much focused on COVID-19 type of symptoms. So many other types of symptoms are still not covered. So for instance, in the US, yes, you will now receive paid sick leave if you have COVID-19 type of symptoms. But for instance, if you have cancer or so, like that is not necessarily the case that you will receive paid sick leave. So that's still very problematic. And across also certain countries, access may still be quite limited, actually. It depends per country, but there's still large groups. For instance, I'm from the Netherlands originally. Self-employed persons are still very poorly covered there, even in the case of COVID-19 symptoms. Sickness, return to work should still be very much on top of the agenda. Like there's a lot still here to improve to make sure that this is an active policy. And also countries should better prepare for future pandemics. For instance, having pandemic laws in place, as for instance, Germany and also as for instance, Korea, but many other countries did not have this. Let me just talk 1 minute very briefly, if I may still, about Korea. So as I said, we started a new project on Korea, providing recommendations how paid sick leave can be implemented here. And we're working hard on this. So I'm very keen also to receive your input on what works and what is important for Korea. Let me just, I hope I made a case that paid sick leave as a policy is very, very important and crucial, and that I really support essentially the dynamics and the dynamics within Korea to implement a proper paid sick leave system. Let me just very quickly sum up a few arguments why this policy is particularly important also in a Korean context. So first of all, Korea is quite, as every country, right? Korea has its own labor market dynamics and specificities, let's call it this way. And the first thing is work practices. So Koreans, I've worked on this myself actually also before. Koreans work very, very long hours. A fair amount of jobs in Korea are of low job quality, although the quality increased a lot, for instance, with the increases of the minimum wage. The injury rate is very high across in Korea, across OECD countries. It's one of the highest because we know actually that there's this strong culture also to go to work. So this presenteeism, contagious presenteeism, going to work and infect others whilst being sick, this cultural pressure and this risk is very strong in Korea. Also, improving social protection and improving job quality by allowing sick workers to stay at home might be very important to improve inclusion, which is a problem in the Korean labor market. We know that female labor force participation rates are low. There's very strong aging in Korea, and older workers do get sick more often. So again, here it's particularly important. And lastly, also because we know that there are social protection gaps within Korea, both on the social protection and as well as on, for instance, on annual leave, where, for instance, workers in small firms may not be eligible to annual leave or to lower levels of annual leave. So there's a real need for paid sick leave. I happily refer you to further reading, and thank you very much for your attention. Thanks so much.
Thank you so much. So he shared with us the overview and the situations of the average of OECD countries. Now let me invite the last presenter, Ms. Dr. Hee-Jung Kang from Kihasa.
Hello, everyone. I am Hee-Jung Kang, working at Kihasa. So I am researching the health-related policies. I have met Stefan before in a meeting in the past, I think. And in 2021, Here in Korea, there's a lot of discussions on the adoption or introduction of sickness benefit, and I am running a research project concerning that topic, sickness benefit. And taking this opportunity, I'd like to emphasize my message. So in Korea, we have a discussion on sickness benefit in Korea. So I hope that the sickness benefit discussions can further advance in South Korea. With this in mind, I have prepared my presentation.
팬데믹을 경험하면서
So while experiencing the COVID-19 crisis, one of the biggest change that we have seen in the society is that all workers and all people in the society recognize the fact that even if the workers are sick, they are not able to stay at home. So that was the culture and the society that we were in. So even if they are sick and many of them could not stay at home, they needed to go to work. And that recognition was made by many people thanks to the COVID-19. So the Korean version of New Deal policy or program has been announced by the Korean government, and the key message of the program is to
지금 우리가 준비해야 되는 것은
make preparation for strengthening a social safety net. So the reinforcement of the social safety net was the main message, one of the main messages of the Korean New Deal program. And especially a lot of focus was began to be made on
2022년부터
supporting income loss, and as part of that is the sickness benefit option that has the option has come up as part of the important discussion topics.
체계적으로 구조화되어 있습니다. 여기 보시는
Please
것처럼
take a look at this slide. As you see here, we have a overall social security system. And for older senior citizens, we have the national pension system in place. And for the unemployed, employment insurance system we have.
제일 밑에
And
보시는
but as you see at the bottom,
질병이 발생할 경우에는
in case of industrial accidents,
오른쪽에서 보시는
workers
것처럼
are
소득 보장뿐만 아니라 동시에 의료를
covered by the industrial accident compensation insurance. However, for the other sicknesses not related to workplace or not related to occupation, Korea did not have any sickness benefit.
보장을 하고 있습니다.
The National Health Insurance Program is offering only the medical benefit. So there was no measure to no program to support income loss of workers. So one piece of the puzzle was missing here in Korea so far, but now we are studying the full swing discussion on the introduction of sickness benefit. One of the disadvantages of the Korean system is that the paid sick leave or sickless benefit are not stipulated in the labor-related laws. So as a result, paid sick leave is not officially adopted or stipulated by the nation.
그나마도 사업장에서 만약 사고로 인해서
And if there is an industrial accident in workplace, the concerned worker, as I mentioned, is subject to the coverage of the industrial accident compensation insurance. So the income loss is covered as well. But for other sicknesses not related to the workplace, there was no such thing as a sickness benefit in Korea. So if the size of the concerned company is really small, and if the employment conditions is really poor, it's really difficult for workers to get any benefit. And please take a look at the numbers and figures that were extracted from the statistical data. So as you see here, the bigger business says there is, the more likely the protection, the more likely the protection is higher. So the sickness benefit needs to be introduced in order to give universal access to paid sick leave to every worker. And this is the slide that captures the international organizations' effort so far in relation to paid sick leave or the sickness benefit. So ranging from the United Nations, WHO to ILO and OECD, and so the sickness benefit or paid sick leave have been considered important. And there were recommendations on adopting the sickness benefit by many international organizations. And this is a slide that shows you the data related to the OECD. 32 out of 34 OECD countries have secured sickness benefit systems. And what draws our attention is that France and some other countries are providing sickness benefit by through social insurance. And there are countries that are providing sickness benefit in the form of the combination of employer liability and social insurance. So there are many types available. So when we think about Korea, we need to think about all these options. So which option will be offering us most stable financial situations? And this is one of the things that we have to consider in mind as well. But here in Korea, sickness benefit is not yet stipulated in our laws and regulations, and at the moment, the paid sick leave is up to the decisions of companies. So that means that we have a challenge to make it mandatory for companies to adopt the paid sick leave system. However, that's going to be difficult. So just like France, should we go for the way just like France? Or should we recommend strongly companies to adopt paid sick leave system? So there are many options available, but we need to think about what is the most sustainable option for Korea. As Stefan mentioned, the most desirable option for workers is to give sickness benefits or the paid sick leave by employers. And the next slide is about the National Health Insurance Act. So when you take a look at the Article 50 of the National Health Insurance, there are kind of legal basis for the adoption of sickness benefit, but they use the word may. However, there were no detailed enactment decrees so far. Enforcement decrees were lacking. So at the moment, there's a discussion from a legal point of view as well. And I'd like to move on to the next slide. And the process of discussing, having a discussion on sickness benefit, many experts are involved. And these are the basic principles that we have in mind. And among the OECD countries, Korea probably is the last country who is trying to adopt sickness benefits. So we need to reflect and receive many insights from other countries as well. So we need to also think about what is the best way to include the self-employed. So we'd like to offer universal coverage so that we can also include the self-employed people. And the second principle is the adequacy and benefit. We need to come up with the right level of benefit. And the third principle is the fiscal sustainability. So that is probably one of the most important principles that are considered important by many other countries as well. And the fourth principle is efficiency. We need to strike a balance between the universal coverage, benefit adequacy, and fiscal sustainability. Only when we have a harmonious relations between these three, we will be able to deliver good systems to general public. And this one is about the current situation. As the previous presenters already mentioned, in case of sickness, workers have two risks. The first risk is the risk of losing job, and also the second risk is the risk of the losing income. So job retention cannot be guaranteed with the sickness benefit at the moment here in Korea because sickness benefit is not clearly stipulated in our law. So based on the principles that I have shared with you, experts involved are having discussion together. And so this is the overview of the sickness benefit scheme. So as much as possible, we need to make sure that every worker is not discriminated at the right time. They need to get medical benefit, and also they need to have timely treatment and recovery when they have a sickness. So our goal is to protect them with social health program. And strategy is to introduce sickness cash benefit on the basis of the national health insurance qualification. And also, the sickness benefit should be at the same level or higher than the amount given by the unemployment benefit. But we have several challenges to tackle first. So we need to think about small size companies with less than 50 employees. And compared to other countries, the portion of small businesses here in Korea is higher, much higher. It is even 45% of the total. This poses a risk for us. That's why we need to think about how to handle those situations. And the second challenge that we need to tackle is that we need to come up with the more effective social security coverage. So in order for that, paid sick leave system should be stipulated in laws and regulations so that the employers can take the liabilities. And so this is one of the challenges that we need to tackle importantly. And another challenge that we need to address is that acceptability, because in economic downturns and recessions, in difficult times, the general public is more likely to develop a sense of rejection to pay for more social insurance fees. We need to think about acceptability. So the level of acceptability or a sense of rejection that may arise can serve as a constraint. And also, the more necessity we care for the vulnerable workers, there are more necessity for caring for the vulnerable workers, but there are more difficulties to care them in the current system. So this is the last slide. There are many changes in financial situations or finances of every country around the world due to the COVID-19 crisis. We'd like to take a phase-in approach So we will come up with several options for sickness benefit, and that's why we have a plan to run a pilot program for 3 years. So please give us insights so that we can run a good program. Thank you very much.
네, 마지막 발표 감사드립니다.
Thank you so much for the last presentation. So the presentation session is all done. Now we're going to have a 10-minute break for the next discussion session. And in the next roundtable and discussion session, we're going to have a moderator of Kang Shinuk Kang from Kihasa. So please come back in 10 minutes.
네, 안녕하세요.
Good evening, ladies and gentlemen. I am Shinuk Kang from Kihasa.
앞서서 네 분의 발표를 듣고
So we had four presenters in the presentation session, and now we are going to have a discussion session, and I'm your moderator today.
앞서서 발표하신 네 분의 발표 매우
First off, I would like to tell you that all of those four presentations were very informative and useful
저희 한국
and knowledgeable.
지도자들이 지금
Thank you so much.
모여서 토론을 진행하기 때문에
And discussants are all gathered together here at the table in the same physical place. So please understand that we will keep wearing masks. We have two discussants and one presenter. Let me introduce them one by one, followed by questions and answers and comments. First up, First, Kim Kunju Kim in the Korea Labor Institute, and next to him, Ki-tae Kim from Kihasa, and right next to me, Hee-jung Kang from Kihasa.
강희정 박사님은 앞서 발표에서
Ms. Kang, as she introduced before she made a presentation, was the one who is in charge of the design of sick leave.
거꾸로 질문을 하시는 것도
Sickness benefits. So even those presenters in the European countries may ask her any questions if there's any. Then from
정도 질문과 토론
Mr. Kim Ki-tae Kim for 20 minutes, 10 to 20 minutes, please.
Thank you for the introduction. My name is Kim Ki-tae from Kihasa, and so I'm also part of the research team along with the Dr. Kang. Also with Professor Becker and with Professor Brun, I had the opportunity to study together, and I have given you a lot of questions, but the two of you from Europe actually were very patient, and you two were very thankful, in my view, because for giving us a lot of guidance. And taking this opportunity, I'd like to share with you some questions. So this is a common question to the old speaker first. So European countries were ahead of the other countries in adopting sickness benefit. Maybe in the process there must have been some errors and mistakes. So from the Korean perspective, we need to learn the lessons from European countries in advance before we adopt or introduce sickness benefit system in full swing. So can you give us any advice to Korea? Korea is about to adopt a sickness benefit system. So is there any advice to Korea you can give us? That is the first question. And when I take a look at the Frank's presentation, when I take a look at the slide number 8, so in the past, benefit was given from employment insurance. So why was that? What was the reason for that? So that was the question to Professor Brun. And I'd like to move on to the German presentation. So when I take a look at slide number 10, so you mentioned that there was an aid program for the self-employed. So the government spent 140 million euros. So was that a temporary measure, or was that a new system adopted? So I'd like to get more clarified explanations. So, but it would be great if you give us further explanations on that. And so for the last presenter, please take a look at slide number 10. So you shared us the Korean data. So based on what basis was the data collected? Please tell me about the data. So rather than sharing my insights, I think it would be great to give you questions and listen to your answers. Thank you.
네, 김기태 박사님께서
Thank you, Dr. Kim.
세 분의 발표자께 각각 질문을 하셨는데
Dr.
대답을 준비하신
Kite Kim
대답은
asked 3 questions to 3 presenters.
마지막에 저희가 듣도록
The questions will be answered after the discussions, comments, and questions. Then now, Kunju Kim. Good evening, ladies and gentlemen. As kindly introduced, I am Kunju Kim from Korea Labor Institute.
말씀드릴 부분은 구체적인 질문은 아니고
So what I'm going to talk about is actually comments on the Korean situations rather than questions. For example, the statutory paid sick leave that was mentioned by the economist of OECD is hard to be introduced in Korea. Why? From the perspective of researchers, it is a very important system, but we have to take a look at
이 부분을 말씀드리면
the complaints of the labor and management.
한국에서 상병수당과
In Korea,
연가제도가 도입이
paid sick leave and
상당히 오래된 일입니다.
also the sickness benefits
있었지만
were tried to be introduced in 1960s, but it was failed
노동조합을
to become legalized, to become legislated.
통한
After that, through the collective bargaining of labor management,
약정 병가제도라고
a sort of a
컨트랙처 페이지
contractual paid sick leave
많이 노력을 해왔습니다.
was tried by the
이라고 할 수 있는
trade unions.
이상 사업장
And at the moment, the large companies with more than 300 employees and also a number of public organizations have such contractual paid sick leave.
사업장의 단체 협약이나 취업 규칙이라고 할 수 있는
But it really depends on workplaces. And this system was introduced by workplaces.
상급 노동조합이라고 하는 이
But from the perspective of the trade union, which is the highest at the hierarchy of the impact on the labor and management relations, and so the trade union has been trying to push a workplace-specific agreement at the moment for paid sick leave. So it is the reality which work as an obstacle. One additional comment on the Korean situation is related to cultural pressure. Korean workers are less likely to apply for leaves. The rate of the actual annual leave applications is very low. And Korean annual leave system is very unique. For example, the basic number of days for annual leaves is 15 days per year. But once you work for more years, then the statutory maximum period of the annual leaves will increase to 25 days from 15 days at the initial stage, initial entry of job. So this is not a universal and this is not a common system that can be shared by other countries. So in Korean culture, leaves are considered and perceived as something of some types of compensations. So when we introduce the paid sick leaves, they say, the management insisted that they have to consume their annual leaves first. Like mentioned earlier, the holidays and leaves and paid sick leaves have different functions and different reasons to be. That was when they were introduced. But it isn't really appealing to the Korean public at the moment. So when we introduce and when we are trying to introduce the paid sick leaves, first off, we may have to review and rearrange and restructure the entire the benefit system for workers. As mentioned by the economists, the OECD, the Korean labor market is very unique, and the Korean labor market will be even more polarized. And that polarization is now being approved by the government, so to speak. In any situations of such conditions as COVID-19 situations, workers are not guaranteed any compensations. And that's not the stance for any social security system equipped state to take. So in Korea, together with a sickness benefit for Korean society, it is such a challenge to introduce paid sick leaves. And the opposition of the labor management against it is quite strong, stronger than you may expect. And initially, Korea has had its own system for benefits, like a differentiated maximum period of the annual leaves based on the continuity of the working years and something like that. So we have to also take that into account, and that's the restraints that we are faced with in Korea in introducing such a new system. Thank you. It was very brief and concise comments and question. Then now, for the questions from Ki-tae Kim, I would like to invite our presenters first to answer those questions. First, Mr. Matthias Brun, followed by Dr. Becker, and then Stefan Teusen. Matthias Brun, please. Matthias Brun, yep.
Thank you very much, and also thank you, Dr. Kim, for your question, but also for your continued very fruitful exchange during all this work we've been sharing. I will just briefly respond to your question. You were wondering on my slide number 8, why in 2020 there has been a switch. So I have explained in the presentation that there has been new benefit, for instance, for parents who had to stay at home because childcare facilities were closed. Well, the switch is relatively simply explained by responsibility of the payers. So since most of these, well, specifically all of these beneficiaries were not strictly speaking sick, they were either infected or just a parent of a child, it was not considered that these were benefits that should be covered by the health insurance branch. So it has been transferred in terms of the payer logic to the state and to the Ministry of Labor. Thank you. I hope that was clear.
예, 감사합니다.
Thank you. Then next, Mr. Becker, Dr. Becker.
Yeah, please answer the question regarding what was the aid program. Yeah.
Yes, thank you very much for the questions, Mr. Ki-jae Tim, and thank you very much for the co-working in the last month and weeks. You asked if we can give any advices for Korea from the German point of view. This is very hard to say because the German system is, I think, it's very generous. About 100% of net income will be replaced, and from the first day, I think it's one of the best systems we can find in the OECD countries. So it's hard to give an advice. What we can learn from Germany is that the introduction of sick pay depended on the strength of the trade unions in Germany. We had lots of strikes in the 1950 years to give pressure to the government to let a law act on the paid leave. So that's one of the answers. You have asked for the economic aids. the economic aids are not as a social benefit, of course, and are not a social benefit, but a temporary support. Temporary, it's prolonged to March 2020 at this state. Temporary support for companies, even for great companies, just like Lufthansa, the airplane company, small companies, and solo self-employed persons. It is a very complicated system, but it's quite generous. So that in the economic view, we had no big problems of insolvencies of companies in the last months. That's a good system, has been a good system, but very expensive. And the financial problems of the states are quite obviously.
네, 감사합니다.
Thank you. Last but not least, we would to invite Mr. Stefan Tewithen.
네, 여러분 기다려 주셔서
Thank you so much for waiting.
저희 한국 측의 기술적인 문제 때문에
On our side,
잠시 동안
there was a technical
영상하고
issue,
음성이
so we couldn't transmit video and voice. But thank you so much for being patient with us.
다시 저희
Now,
프로그램으로 돌아가면
let's get back to the discussion.
스테판 테위슨 선생님께서
So,
질문에
Stefan
답하실 차례
Tewithen was supposed to answer, so please. Dr. Tewithen?
Thank you, and no problems whatsoever regarding technical difficulties. I'm already very impressed by organizing a conference like this between multiple continents, multiple time zones with simultaneous translation. So thanks a lot, really. I'm very impressed. So this can just happen, right? So it's all good. Let me just say, so the lessons from other countries, first of all, as I said, the importance of the system, given how important this factor is, that sick workers go to work, infect others, and that actually is a very severe health risk, and all the more during COVID, and that this actually could lead to more sickness absence. That's the first lesson. The second is this on access, having very broad access, and that voluntary systems work very poorly. For instance, in Korea, but also in other countries where, including Germany and the Netherlands, where I'm from, where, for instance, self-employed persons can register, like there's voluntary access for self-employed. And for instance, in the Netherlands, actually less than 2%, so virtually no one of self-employed register with, so take up voluntary insurance. But then a third one, okay, undue absenteeism might not be a big problem, but however, what is very crucial, and here really Korea should like really implement a very innovative system, is to have this activation side in it. So to really think about return to work, early engagement with sick workers, prevention where possible. And so what does that entail? We will be much more lengthy in our report, but it entails engaging employers, engaging workers, engaging public authorities also, like public employment services, so that workers and employers have like supports. And so, for instance, this could imply, this could, for instance, include thinking about like really focusing on remaining work capacity rather than sickness. So assessing people on the basis of remaining work capacity. Looking at like other types of jobs within or even outside the firm that are still possible. Things like, for instance, starting gradually with working again, so gradual working hours. This might be particularly interesting for Korea, given its its big emphasis on working hours. And so on the complaints from the firm side, so saying like this was the point from Kun Joo Kim from KLI. I have a few comments on this. So first of all, again, this point, yes, some firms do provide something, but it's very minimal in Korea. Second of all, actually like having a statutory sick leave system might be much more equitable and might be much better for business reasons. So now there's really this kind of unfair competition actually for a few firms who do take responsibility, whereas others do not. This risk of contagious presenteeism, so sick workers coming to the workplace, making others sick, that's even larger actually at the workplace, where sick workers will spend most of their time. So they really have an interest. However, again, also here, yes, I think I would very much propose a universal paid sick leave system, but then make it as universal as possible so that this point of unfair competition is as low as possible, so that everyone contributes, including self-employed. That's the first point. And again, to have this really strong focus on return to work, including also responsibilities for the worker, for public authorities. Last, there was this question on cultural pressure. And I think this is a very tricky point. I'm curious also to hear from the Korean side, actually, on this cultural issue. We could think about a few elements, right? The first one might be, for instance, give all workers an entitlement to work from home. If there's this strong pressure to continue to work, okay, well, let's facilitate that at least in such a way that this risk of going to work sick, that is minimized so that everyone can at least work from home. You could even make it forbidden actually for sick workers to go to the office. That might be possibilities. The role of the labor inspectorate should be perhaps reinforced also further. But I understand that this is a difficult point. So I'm curious to hear also on your end. Thanks so much.
네, 감사합니다.
Thank you.
스테판 테위슨이 지적한
Thank you, Mr. Stefan. And you talked about presentism. Now it is over 7 p.m. now in the evening. And the presentism is one of the issues that could be felt in reality here among Korean people, many Korean people. And as a moderator, I'd like to give you 2 questions. First, my question goes to French speaker, Matthias Brun. So with the COVID-19 getting prolonged, is there any benefit? You talked about there is additional benefit given on top of the sickness benefit. So how can you how could you require employers to pay for the additional benefit? So what was the way? That is my question. And to Professor Becker, I have 2 questions. One question is that you talked about support for employees in quarantine. So you mentioned about Infection Protection Act. So Infection Protection Act is one of the acts of Germany. So does it mean that Infection Protection Act was revised to give support for employees in quarantine, or was it the original content of the Infection Protection Act? And also, the second question is that you talked about citizens insurance, including self-employed people. You mentioned about civil insurance. However, in order to do that, we need to identify the income of self-employed people. So only when we have the right data about their income, we will be able to think about giving benefits to them. So how can you serve the issue identifying the exact income of self-employed people? So that is my question. So first, Mr. Matthias Brun will answer the question.
Yes, thank you very much for the question, which I think relates to the idea, how can you motivate, incentivize employers to buy in and to pay? So there are 3 scenarios in France in the context of COVID to consider. The first is the additional benefits for instance for people who were in quarantine, so who were infected but not sick, and others who were taking care of a child who was not in childcare. These payments did not concern employers because they have been switched to the state and the Ministry of Labor. So they actually did not concern the classic tier of sick pay. The second scenario is that where benefits have been extended to social groups, to professional groups who so far did not benefit from sickness benefits. in this scenario, employers are not concerned because sickness benefits are borne by Social Security, and the professional groups that have been newly included are mostly self-employed. So the self-employed do not have an employer contribution because they are themselves the employers, obviously. So that was not a significant portion where employers were involved either. And the third scenario is simply the one where the person contracts COVID, obviously, and requires sick pay. Well, here in France, I think as in Germany, the employer simply is obliged to pay. It's stipulated by the labor code, and this is just a continuation of the existing regulations.
Thank you. Thank you for your answer.
게르하르트 베커 교수님 답변 부탁드리겠습니다.
So, Mr. Becker, please go ahead with the answering the questions.
네, 베커 교수님 지금
Professor Becker, can you hear us? Can you hear us?
I can hear you. I can hear you.
Go ahead with the
감사합니다.
answering the questions.
계속 말씀해 주십시오.
Please go ahead.
Yes, two questions. The support in the event of quarantine has long been a part of the regulation under the Infection Protection Act. This is not a new regulation. However, the law has been amended several times in other respects, but not in the income support. And to the second question, it is indeed very difficult to determine the income of self-employed persons. This requires at least supports from the tax office. There's no other way than to ask by the tax office how high is the net income of self-employed. But it's indeed a very difficult question.
네, 답변 감사합니다.
Thank you for the answer.
이렇게 해서 저희가 지정된 토론자들의 질문과 발표자들의
So
답변을
this ends the Q&A session in the discussion session. So are there any further comments or questions that you can share with us? So speakers are able to question as well. Please raise your hand. Yes, Mr. Byrne, please.
It's an observation and then a question, because I'm fascinated by this project of introducing these benefits in Korea now, and as you have pointed it out several times, it's a major cultural challenge. So I now have a comment from a more health services research perspective, because in all what we've been talking about so far, we have been talking about macro considerations, the role of institutions, state and labor market payers. But what I think is an interesting observation is to see that what happens at the front line, so where sick leave is determined, the place where this is determined is, in any case in France and in Germany, the physician's office. And many physicians, and I've seen this myself in both countries, are actually spending a significant amount of the time with patients who have these type of questions. And the medical providers are thus basically social policy entrepreneurs. They and themselves experts in advising patients how long should the sick leave be prescribed or not, what would be alternative benefits, what would be intermediate solutions towards pensions or other solutions to account for this particular situation of the patient. So what I'm saying here is these are actors that are embedded in the system. This sometimes causes problems, and French Social Security is very much concerned, for instance, with the high prescribers of long sick leaves. So there are doctors who are outliers in terms of the numbers and the duration of their sick leave prescriptions. My point here for you as a question, or maybe as a recommendation, is also to maybe actively engage these actors and these social policy entrepreneurs in your pilot project, and maybe to see if you can train them or give them guidance, because as I understand right now, this is not at all part of what they usually do in Korea. Thank you.
네, 매우 좋은 질문 감사합니다.
Thank you for your good question.
답변을 해주실 강희정 박사님이
Well,
항상 고민하고
Dr. Kang
했던
will
내용인데,
answer the question, and she has been always thinking of it indeed. But before getting the answer from her, I saw Dr. Becker raise his hand, so we're going to listen to his question first, followed by the answer. And then I'm going to give a chance to Stefan Thyssen for question and any comments. Okay, so Becker?
I've got a question to situation in Korea. In Germany, let me say, the continued payment of wages is also covered to a large extent by collective agreements. What is the situation in South Korea? It's a very important point in Germany, the bargaining power of the trade unions just for the continued payment of wages.
네, 질문 감사합니다. 그러면
Thank you for the
질문을 마저
answer.
듣고,
So I'd like to move on
적절한
to
답변자가 답을
Stefan,
드리도록 하겠습니다.
and then we'll go to the
네,
answering
스테판
session.
테이센 박사님.
Mr. Stefan Terrison, please.
Thank you. I mean, actually, my question relates to the question from Professor Becker. So indeed, like I have two questions for Lee Jung Kang. By the way, very good presentation, really interesting. So indeed, like you emphasize that this phased-in approach with social partners is important. And my question is, first of all, could you elaborate, like, why do you think this is important? And let me indeed like refer actually to the question of my previous speaker. It's actually collective bargaining rates are very, very low in Korea. Like about 14% of workers are covered under a collective bargaining regime. So this is very different from the situation in, for instance, Germany or the Netherlands or France, where social partners play a much larger role. And also, I mean, we've received this question from Kunju Kim on cultural aspects. I've tried to give an answer. Could you elaborate perhaps how you think this cultural aspect of not taking sick leave even when you're sick, how this could be improved? Thank you very much.
예, 네.
Thank you.
세 분 질문 모두 감사합니다.
Thank
질문의
you, all
내용을
three
제가
speakers.
들어보니까
Listening to the
강희정
questions,
박사님과
Dr.
김근주
Kang
박사님이
and
답하실
Dr.
내용은
Kim
각각
Gun-ju
순서대로
are
강희정
supposed to answer those
박사님께서
questions. Then first, Dr. Kang, please, followed by Dr. Kunju Kim.
네, 질문 감사드립니다.
Thank you for the question.
첫 번째
First of all, I'd like to tackle the first question.
없었던 제도고
Actually, the sickness benefit system has not been introduced officially to Korea. So once we try to adopt the new system, we need to
근로자가 며칠 동안
engage more people to participate in the program. So for how many days sick leave is given and to which level of income should be guaranteed. So in order to tackle the problems, medical certification is needed. So we are trying to assign some role to doctors. So we need to engage doctors as actors. But there's a discussions on what qualification is needed for doctors to play as advisor, for example. In European countries, a sick leave system has been adopted from long time ago. But because of the fiscal difficulties in the middle, because of the economic crisis, generosity has been decreased a little. Certifying the medical institutions has become more tougher. So that's why we also, Korea, has a plan to apply thorough certification system. But doctors have never experienced this new system here in Korea. So in advance, we need to define to much degree how many days of sick leave is given and to which level, so that information will be given to doctors so that the doctors can deliver the right medical certificate. And that is one of the important considerations that we are doing. And as I mentioned in my presentation, we have a plan to conduct a 3-year pilot program or project. So we will expand social dialogue to make that happen. So from next year, for about a year, from each sector, we will invite the relevant experts and shareholders, stakeholders, so that we can share insights with each other. That's the plan.
Thank you for the question.
한국은 단체협약 시스템이 유럽과 상당히 다릅니다.
Now, Korea has different collective bargaining system from the European countries. Let's say the collective bargaining is actually done by company by company, and the application rate is around 15% and up to 20% indeed. And
미치는 영향은
the impact of the collective bargaining on workplaces is quite practical, although it's not really applicable. So then, even taking that into account, the rate, the impact rate is less than 30%. But industry-based collective bargaining may bring about a better and more impacts, because it can make an impact on the entire industry in a unified manner. But in Korea, collective bargaining is really based on companies, company by company, case by case. It really depends on the budget and the financial capabilities of the companies and enterprises. We have this company which can provide a maximum of 7 years of pay, sick pay. So it really depends on the companies with or without sick pays. Even among companies with the sick pays show huge differences in terms of the amount of sick pay. And also the perception of labor management vary and differ, and I completely agree to what the speakers said. What I think is very strange is that one of the catchphrases of the Moon administration, the current administration in the COVID-19 situation, is that they would create a society where a sick worker can rest. That means before the COVID-19 situations, even if you're sick, you have to work. So that's not something normal. That's out of common sense as a human being, I think. So universal resting system and sick pays and sickness benefits as part of the social security system should be definitely implemented. And the public awareness should be raised as well. Their awareness of the sickness benefits is lower than the experts indeed. So we also have to make sure the public awareness should be raised. Thank you so much for your questions and answers. And now it's time to wrap up the webinar. We had 4 presentations and 2 discussants. And 3 presenters, the first 3 presenters shared their knowledge and situations of those advanced countries with better sickness benefits. And they let us know very good examples and best practices of how the sick pay and sickness benefits were used in spreading throughout the society. The Korea has to learn a lesson from them, so that we can design a very sophisticated and specific policies and measures. Among the presenters, I can tell some of them who were already involved in our project and our the advanced policies. If not, if you're not one of them, then please support us in the future project. Well, unfortunately, a number of confirmed cases in Korea reached the record high. And so this is a new concern, a new threat. And so, but we have to hope that we will create a better society so that we can come over the COVID-19. Have a good lunch over there in European country. Thank you.